On many fronts. We now have developed technologies where we can effectively merge photography, video, CT scans, intraoral scans, computer planning, surgical planning, planning exactly where our implants are going to go, what the bone consistency is, where we're going to place them. We can basically do a dry run digitally in our heads with so much accuracy. So when it comes to the actual planning, there's less guesswork. We know what we're planning for, we know what we're going to find, and the surgery, therefore, it obviously goes much more smoothly. But also the ability to manufacture dental prostheses using much more modern methods, using computer-aided design and manufacture, makes a massive difference to the reproducibility and durability of the restorations that we're carrying out.